Oh, I know this from personal experience. Headaches and migraines can cause significant discomfort, but they can differ in their symptoms and therefore their treatments. Joining us to shed some light on it is BayCare neurologist, Dr. Sanjiv Sahu. Welcome to the show. I am so glad we're talking about this today. How are you?
I'm doing very well, thank you.
So let's first dive in. Let's talk differences between headaches and migraines. I know I have that internal debate when I start to feel one coming on. What do you tell patients who are trying to differentiate between the two?
So, a migraine is actually a type of headache, but it is probably the most common type of headache out there. And it's not just a headache, it's something so much more, and it's so much more debilitating. It's a headache associated with so many different symptoms, sensory, limbic, homeostatic. For someone who's actually suffered a migraine, they know that when the migraine begins, they have these prodromal symptoms like a premonitory phase where they can feel mood swings, they can feel fatigued, they might have yawning or just a sense of tiredness. And then it goes into the second phase, which is like an aura stage, and that's when all the sensory symptoms start coming in. You have visual disturbances, you might have some smelling changes, you might feel nauseous, you might see spots, sparkles, flashes of lights. So once that hits in, you go into actually the migraine stage. And the migraine attacks are quite typical. You get that unilateral throbbing headache, it's pounding, it's associated with nausea, vomiting. And then sometimes you'll have the photophobia and the phonophobia, the sensitivity to light and the noise. And it's pretty debilitating, can last from up to 4 hours till a few days. And sometimes you get those complicated features that are associated only with migraines, the weakness, the numbness, the tingling, sometimes slurred speech. You can even get room spinning. So once that sets in, then after the migraine attack goes away, you still have a few days of just a hangover, tiredness kind of effect. So it's quite debilitating.
Dr. Sahu, I'm curious, and I remember when I've had a migraine, it's like, okay, now I'm going to go to the doctor, or maybe the next time, and then you kind of procrastinate. What do you tell people? When is the good time to talk with someone like yourself in neurology?
So as I said, migraines can be quite debilitating. Now, if you have headaches that are at least 4 or 5 days out of a month, then it starts to impact your social life, your professional work life, and if you're missing days, then you definitely want to seek professional help, especially if the over-the-counter medications stop working. That's when you basically will want to go and see someone. Additionally, if the headache isn't a migraine and you actually have something else, then you want to make sure you're not missing something more ominous. Let's say the headache's persistent. Let's say it starts building up and it doesn't respond to medications. Let's say you start having pressure symptoms, blurry vision, you're throwing up, and you have neurological deficits that are progressive. It could be a brain tumor that's growing, it could be a bleed if it happens suddenly. If you have a fever, or if you have seizures or just confusion, then you want to worry about infections like meningitis or encephalitis. So those are the other things that you have to watch out for when you have a headache. It's not just a migraine. If it doesn't act like a migraine, and if it's bothersome, then you definitely need to come and see us.
Well, we only have a few seconds left, but I want to talk about treatment options that are out there. Like you said, when over-the-counter doesn't work anymore, what are you able to do at BayCare to help as we get ready to share their contact information, of course?
So as you're aware, migraine has been around for decades. So we've had multiple different medications that have been highly effective. But the exciting thing is, in the last few years, they've come out with the reason behind the migraines. There's a particular receptor in the brainstem, in the trigeminal nucleus, called the CGRP receptor, the calcitonin gene-related peptide receptor. Once you block that receptor, you can abort a lot of the migraine symptoms. So in the last few years, we've had so many new medications that you can take to abort or prevent the headache. So if you prefer, there's a medication that's called Qulipta that you can take every day. It's a tablet form. You can take Nurtec, which is every other day. If you want something less frequent, you can have an injectable that's once a month, Aimovig, Ajovy, Emgality. If you want something less frequent, you can do it once every 3 months, like a Vyepti infusion. And then there's new abortive agents that you can take that are highly effective when you get the headache. So you can take Ubrelvy or Nurtec. There's even a nasal spray that works within 15 minutes. It's life-changing.
So many.
It's amazing.
I'm so glad the way science and yourself has helped patients. There's the information for BayCare so you can get in touch with them today.